Junior Doctors! Welcome back to Junior Doctor Fiona Chow's YouTube channel. In today's video, we are going to talk about symptoms and mortality, which is continuing on from last few weeks' videos. Okay, so let's get started. So first of all, the symptoms of COVID-19 or SARS-CoV-2 include causes the respiratory infection, which leads to viral pneumonia, and ARDS, which is acute respiratory distress syndrome in some patients. And it also causes cold, flu, food poisoning symptoms, for instance, chills, sore throat, dry cough, diarrhea, shortness of breath, and body aches, headaches, fever, fatigue, pneumonia, loss of appetite, and nauseousness. And second, the uncontrolled infection can also trigger a cytokine storm, and some patients experience heart damage. It's still unknown about the long-term effects of these heart damages, and some patients also experience temporarily loss of taste or smell, indicating the neurological tissues are vulnerable to infection. And there's a smaller number of patients that experience severe psychosis or delirium, including thoughts of violence, hearing voices, paranoia, or physical violence. But it's probably a side effect of the antiviral immune response and brain inflammation. And the long COVID is that some patients experience symptoms for months, even if the initial infection was already mild. And in rare cases, there are severe inflammatory cases, MIS, that is experienced secondary to the initial infection in children and adults. Mortality. So about 15% of COVID-19 cases are regarded as severe. So patients require supplemental oxygen in the hospital. That's what is called medically severe. And 5% of hospitalized patients require ventilators. That means something to help them breathe, a machine to help them breathe. And the bacterial co-infections highly correlate with life-threatening COVID-19. So more than 50% of people who died during the 1918 Spanish flu died of secondary bacterial pneumonia. So I've mentioned about Spanish flu. It's super deadly. It's one of the deadliest pandemics in history. And so as I mentioned, the bacterial pneumonia, the secondary bacterial pneumonia includes Streptococcus pneumoniae and Staphylococcus aureus. Okay, so let's end our discussion there. And remember to drop down any comments you have, any questions, or any topics you're requesting, and I'll have a possibility of seeing it and trying to dive deeper into it. And remember to eat healthy, exercise, and enjoy life. Thank you so much for watching, and hit that like button, subscribe, and turn on post notifications. Thank you, and see you next time!